Good morning, and welcome to our continuing series on homeopathic treatments. As always, with Dr. Pachegaonkar. Namaste. Today's subject is a very interesting one because it is patient participation in homeopathic treatment. What percentage of patient participation is necessary?
It should be 100%.
Oh.
It should be 100% in the sense, in homeopathy especially, it is the patient's own vitality and healing potential which is brought into the practice, or it is stimulated, or it is what we can say facilitated by homeopathic medicines. The very basis of homeopathy is own healing potential in the individual. So consciously or subconsciously, it has to be his will and understanding who should participate in the process of cure. So unless the will and understanding gets set right, on the right track, the healing cannot take place. And therefore, while discussing limitations of homeopathy, we always say that if the vitality of patient is too poor, then we cannot have good response, and there we say only palliation is possible, not cure. But even in day-to-day practice also, like you see, there are some lifestyle defects which are maintaining the illness. Now, unless those are corrected, we can't expect cure to be like a permanent thing. Again, the complaints would go on recidivating again and again.
Example of some lifestyle difficulties, problems.
See, it's like person is not sleeping properly in time. Suppose someone has a night duty or night watching habit, and if the person is not sleeping in right time, in day-to-day life, we consider that midnight should be the midpoint of sleep. That is the best time for sleep. So, like if someone needs 8 hours sleep, depending upon the age and type of work person is doing, the midnight should be the midpoint of sleep. That is ideal. But if someone is not sleeping even up to midnight or sleeping late at night and then not waking up early before like sunrise, then always there would be low vitality. So if this persists for a long time, and if person has some ailments because of this, any amount of medicine you give will have only temporary effect, and the person will never be cured. Same is the case with the diet. And even the whole regimen, if person is drinking less water, the hydration is very poor, then the renal calculi, they would be gone, being formed. So this way we have to see that the patient corrects the lifestyle if that is the actually the reason for suffering. So if even addictions, we have seen that if patient has a strong willpower, it's easy to overcome the addictions. But if patient doesn't have strong will and understanding to live, then it's very difficult to get rid of the addictions. This is what we have seen.
But then allopathic couldn't do it either.
In allopathy, there are few things where, like they have chemicals. Like someone is in depression, they can give something like antidepressant. Whether there is a reason or not, person will be, elated because of mood elevators. In homeopathy, we don't have that. And that is the reason why allopathy is very good in life-saving measures, where, urgently, if things are set right, at least for temporary purpose, person recovers. But permanently, if one wants to get cured, there has to be 100% participation of the patient, and physician can just facilitate it, help the person to come up in the process of cure.
How much is faith in the doctor?
See, first of all, the person should have faith and will and strong will to live. Faith in himself first,
Hmm.
and then the doctor, and then the process of cure also. We always say the doctors can't cure it unless the potential in the person exists and that potential also is brought into practice or is stimulated.
Mother and Sri Aurobindo say ultimately it is faith that cures.
But faith not in doctors alone. The faith is something is with the higher
Yes.
aim.
Yes. Yes.
That is what the faith means.
Yes, exactly.
That's what I said. Faith in himself, faith in the divine, and faith in general. That's what we call a will,
Okay.
and not in physician alone. Because we have seen, see, we are giving homeopathic medicines even in cattle, even in animals,
Hmm.
even in plants we are giving.
Oh, could
So,
you?
so no question
Oh.
of faith. Like we have seen cattle
Mhm.
responding equally well as compared to even human beings. Rather, with like 400 kg weight cattle, we give just a pediatric dose and they are very sensitive. And then they do respond.
But they don't have the mind.
Yes, but that's what, like negatively also, because
Exactly,
human may have the
exactly.
negative attitude. Animals respond very well to homeopathy,
Huh.
even with the minutest doses.
Could you talk a little bit about plants because I'm so interested in that?
Yes, yes. Plants and the whole farm culture responds very well to homeopathy. It's a live thing, you see. So in plants, like we have been treating last 10 years, we are experimenting in our farm, Matrakunj, and like silicia. Silica is supposed to be most inert substance, most inert. But when we give silicia in a potentized form, the plants become very sturdy. They can withstand the wind, they can withstand the dryness, because silica is something where it's a sand.
Yes.
So we have seen that the plants can sustain all these weather changes and all very well with silicia.
Hmm. And what kind? Mostly you work on vegetables or grains?
Both,
Both.
even in horticulture. Even in horticulture, of course, we have prepared few nosodes also. Nosodes are like the medicines prepared from the disease products.
From the?
For the disease products.
Ah, yes, yes.
So we just potentize them and prepare them. And even this calcarea carb, silicia, urea, these are the medicines we have, and wonderful results we are getting.
But from my experience, urea was overused for many years.
That is in crude form.
Ah.
We don't give that way. We potentize it. Like we have been giving in 6C and 12C. 6C means, can you imagine how much it must be? It
It's
must
very
be like
little.
one drop in one swimming tank.
Yeah, yeah.
One
I
drop
see.
in, and that really is effective. This is what we do.
So, can you give some examples of patients who came to you and had faith?
See, even I have one case, a wonderful case where it was a malignancy case, and it was rather the first case which I encountered as a student. I was studying in my third year homeopathic course, and that time, coincidentally, one female was brought to our house. They were from my native place,
Ah.
and this lady was having a advanced cancer, a terminal illness, and she was discharged from very popular hospital, cancer hospital in Mumbai, the Tata Cancer Research
Ah.
Institute. And
Because they felt it was too far advanced?
yes, they tried. They had
Ah,
operated it, the radiotherapy, and they said the treatment is concluded as disease is too advanced. This was the remark, and they told now hardly few months, take her home. We can't do anything. The patient is not responding. And she was brought to Pune just as her last will. She wanted to go for pilgrimage. And there is one place, if you have heard Sant Jnaneshwar's place, Alandi near Pune.
Hmm.
And they came to our house because they wanted to go to Pune because it was not possible for them to keep her in hotel. She had developed this vesicovaginal fistula where the urine was constantly dribbling and it was not easy to manage. So she was brought, and I suggested, can you try homeopathy in this? They said yes. We have already dead end in allopathy,
Yeah.
so we don't mind. And then I consulted my teacher, Dr. Nana Sahib Marathe. And he said, okay, if they are open to homeopathy, you can bring her. And when I brought her to him, he said, the diagnosis part you have told me, so I don't want to go through the papers. I would just take the whole case from the patient. And he studied her whole genesis of her, from childhood.
Oh.
Like how she has reacted to different life situations and all. Then how she reacts to weather. And he selected causticum. It's a potassium salt, causticum. And he gave in 1 m potency. That time even I was eager to know why he is directly going to 1 m potency. Then he said, see, this lady has clear picture of causticum to the deepermost core. So highest the grade of similarity, we have to go for higher potency and not for low potency. And it was given in 1 m potency. As a student of pathology, I was feeling that the vesicovaginal fistula was developed because of radiotherapy charring and not her innate disease.
Oh.
She had carcinoma cervix, and because of its vicinity, they had given a lot of radiotherapy, and because of that, she had developed this vesicovaginal fistula. So nothing to do with the cancer alone. And it was secondary, sequelae to the treatment.
Yes.
But he said, you don't worry, it is body which has to take care of natural disease as well as the sequelae of the natural disease as well as sequelae of the treatment. So leave it to the body, you don't worry about this. And can you imagine, her son was reporting that she is feeling better, so he used to come and collect, and we used to give almost 1 dose in a month. 1 dose in a month, and for 6-7 months, and then we lost the track of the patient. When I completed my graduation, my internship, and then I decided to open my clinic in our hometown. And when I opened, after 3-4 months, she walked in my clinic, nicely walking, attending sermons and all, and she lived best quality of life for 6 years at the age of 80. Imagine, she was cured. Vesicovaginal fistula was cured. The cancer did not bother her. No pains, nothing. She used to attend sermons. She used to go to temple. She used to interact with the people around, and she was fine up to the age of 86. So here, then I just discussed why every case of cancer doesn't respond.
Yeah.
And this Nana Sahib Marathe, he told me that it was her will, strong will, a positive feeling, which helped in curing it. So here we realize that it is the will, it is the faith, not necessarily in homeopathy or a doctor or in family, but deeper faith in oneself as well as with the divine and the strong will to live. That really helps.
And what if the will is only mediocre?
Pardon?
If the will is not too strong but not too weak? Because many people will be like that.
Yes, yes. And then it is very difficult. If the will is not cooperating, it is very difficult. I remember an incident like the person had a trivial diarrhea and vomiting and little bit of dehydration. The person was around 70, 71, and he was given intravenous fluids as replacement, and otherwise he was perfectly fine. And my teacher, Dr. Mistry, was attending him. And somehow he was just sitting with him by taking his hand and interacting and asking. And outside he told me, not in front of patient, see, the ailment is very trivial, but he is not willing. And next day he was no more.
Oh,
Yes. So it is the will and understanding of the person who has to cooperate in healing. And therefore, even allopathic people, they have seen such instances and they say this is the typical example of spontaneous regression of the pathology.
ah,
The spontaneous regression of pathology is always through the will of the person.
Mother speaks about a case where the person had cancer and the soul chose to die. She said, "There's nothing more I can do."
Exactly.
Yeah.
This is what we say. The faith person, if the person is desperate to live because of some mundane reasons, it's a different instance. But the deep, higher will in the person should definitely be a positive thing to cure. And our homeopathic medicines, that's why even Sri Aurobindo has said that homeopathy works at much, much deeper level. And even in health style, we have seen like the type of food you eat. Same food, if three people are eating, and if they are not eating properly, like in hurry, someone is standing up and grabbing the food, that also affects. So if the person is, what we say, with full awareness, with full love, that's what even mother has said, even when you are handling things, even a non-living things, you have to be very much gentle and with great love you have to handle things. Same way the whole lifestyle. Person has to be positive at every moment, in every action. Then like water intake, food intake, not only the food intake, the way one eats, at the time at which a person eats, the type of food one eats, with what attitude person eats. Everything is important. Same way the treatment also.
What, even with the person's faith, there must be some times when they can't be cured.
Yes. Because what we say, there are limitations, and there are, so many factors influencing the life. In that, if someone has lost so much vitality, even at physical level, and if it is beyond what we call possibility of reversal, then no amount of prompt medication will help.
So you give only palliative, or?
That time only palliative, that's what we can do.
Yeah.
There are what we call terminal illnesses, in advanced cancer and pain. We can just alleviate the pain. We just can't prolong the life.
I see.
But definitely the quality of life improves with medicine.
So even in terminal patients, the quality of life.
Yes, that counts. That
I
counts.
see. Wonderful. Thank you so much, sir.